is healthcare defining patient experience management, and why is it important to transform it? Afsal Salu, co-founder and CEO of BestDoc, is joining us today to answer these questions and more about how ushering in a new era of patient care is becoming imperative. Thank you so much for joining us, Mr. Afsal. So, my first question is, can you tell us more about how you identified the gap in the patient-centric solutions in the hospital software market?
BestDoc started as a B2C marketplace for healthcare. And just looking into the background, I'm an engineer and MBA, and I come from a family of doctors. So patient experience as well as healthcare administration has been the common discussion points while at home as well as with the family. So we've realized that there is a need for improving the patient experience at hospitals. And BestDoc is my second startup after Hyperlocal Marketplace. So we started as a B2C marketplace for healthcare. While working with the healthcare providers, we realized that the patient experience has been lagging with respect to various aspects. So when it comes to hospitals or healthcare providers, the current solutions are all focused on improving the clinical as well as administrative staff work. And when it comes to patient, we realize that they need to interact with the hospital team at multiple touch points. And most of these touch points are manual. So we realized that there is no seamless experience journey which has been available for the patients or their caretakers. And that is when we decided that we need to focus purely on the patient experience. Patients are at the center of everything which happens in healthcare. But unfortunately, most of the solutions have been developed in English for the clinical and the administrative team. Most of the hospitals have stopped at providing only a portal where the patients can either download the reports or look at their prescriptions. And that doesn't sum up the patient experience. When you look at the outpatient, the OP, as well as the inpatient experience, there are so many people who interact with the patients at various departments. And these experiences are not seamlessly captured. So we decided that we'll provide solutions which will help the patients navigate their current care journey better. So that is how we started the BestDoc journey. And we have been working with about 200 plus hospitals across Asia, India, UAE, and Philippines. And we have been also improving the patient experience touch points at all these hospitals.
Fantastic. And more on that note, can you tell us about how digital technology can contribute to the patient engagement and satisfaction?
When it comes to healthcare, what we have realized is the adoption of technology has been a lagging point. And most importantly, in the last few years, we have seen that the other sectors like retail, banking, e-commerce, all of them have provided omni-channel, multilingual patient consumer experience. When it comes to patients, that kind of experience is not available in healthcare. And that is when we realized that digital technology adopted at the right place and time could actually help the providers improve their experience. For example, if there are patients who are coming from multiple nationalities to a hospital based out of UAE, today, most of the engagement is done either in English or Arabic. We believe that if there is a capability to provide multilingual engagement touchpoints, that would enhance the patient experience and also help us improve the navigation of care. For example, our patient feedback solutions are available in 22 languages, which is helping the patients as well as their caretakers provide valuable feedback, which can be used by the providers to improve the patient experience. So we believe an app alone could not serve the purpose. So we have done an omni-channel approach because patients come from different backgrounds as well as of different age group. So we believe that some of them would be ready to adopt or using technology easily, whereas if there are senior citizens, people who are not able to understand the applications really well, we need to provide an omni-channel approach. So we combine the voice as well as the digital navigation channels to improve the patient experience.
Fantastic. And can you tell us more about why is it crucial for hospitals to adopt customized solutions such as unified patient room and service ticket management solution?
When it comes to the in-hospital care journey, we have seen that nurses are at the center of most of the activities which happen within the hospital. And today, the nurses are really stretched, and most of their activities are related to non-clinical activities. We have seen that the nurses spend an average of about 30 minutes to 1 hour doing non-clinical activities compared to the clinical activities where they would be able to add most of the value. And this is where we believe that the hospitals need to implement a unified patient experience and request management solution, as we have been successfully implemented at a lot of large hospitals, JC accredited ones across India as well as Middle East. We have seen that this solution could help the nurses handhold the patients and their family members from the time they get admitted till they get discharged. There are various requests which would come out of a room, starting from asking for room amenities such as AC not working, or they need help in terms of going to the restroom, or ordering for food and beverages. Today, the nurse is being pulled into most of these activities, whereas this could have been directly passed on to the respective departments such as housekeeping, food and beverages, who could take up these activities and deliver exemplary experience to the patient and the family. So we believe that we are putting in a solution, helping the BestDoc concierge solution, which is being provided to the hospitals, is helping the nurses as well as the hospital team manage the activities which are happening in and around the room. It could be extended to various activities such as insurance, billing, as well as even helping patients recover post-discharge at their home.
That sounds kind of very interesting, actually, how patients can be, observed at home. So could you expand a little bit more on that?
Yes. So we believe that today hospitals are looking at providing care within their walls, and most of the engagement needs to happen when the patient comes to the building. We believe that in the post-pandemic, especially post-COVID, care has become much more seamless and virtual. And we believe that is what we have seen during the peak of the COVID, where most of the doctor interactions, consultations were happening online, and that has helped both the healthcare providers as well as the patients who needed care to continue engaging without having to worry about going to meet them in person. And we believe in the post-pandemic world, this kind of virtual seamless care can be expanded by providing a solution which would help the hospitals stay in touch with their patients and also measure how the progress of care has been. We have a solution which has been implemented in some of the hospitals in UAE. For example, Emirates International Hospital in Al Ain has been using our patient feedback solution, which is helping them measure two aspects of care. One is on the quality of outcome, and the second one is on the quality of service. So these are regarded as patient-reported outcome measurement and patient-reported experience measurement, PROM and PREM. We believe this hospital has been able to use our solution to improve their patient experience, and as it has been exhibited in their Google rating going from 3.5 to 4.1 in a span of about 2 months. So we believe that once the providers start using digital technology and invest in being able to reach out to the patients even beyond their walls, they are able to improve their care journey. So if a patient who is at home needs sample collection to be done, or delivery of medicines, or request and doctor interaction when they are not feeling well, they're able to continuously monitor their progress of care and then bring the hospital team to the patient's home if required through our solutions.
That's fantastic. And just, circling back to the mention about how nurses are always either, tasked with too many administrative duties, etc. Like, could you also comment on how it also helps other clinicians in the hospital to have solutions like BestDoc to support them and, just cater to patients in a better way?
Sure. So if you look at the hospital teams, they are two teams. One is the clinical team, which includes the clinicians, the doctors, as well as the nurses, and then the non-clinical team. BestDoc has been looking at how to improve the patient experience around the non-clinical activities. When it comes to clinical activities, the doctors have been using traditionally EMR, electronic medical records, and then capturing the notes throughout the journey, whether it is outpatient or inpatient. And these notes are used for administering medicines, administering guidelines with respect to the progress of care. But when it comes to the non-clinical activities, what we have seen is that be it the nurses or the other clinical team, they would rely on the non-clinical team, which would start from the front office, the patient experience or the service excellence team, Then there are various other departments, which could be insurance, it could be housekeeping, food and beverages, or dietary. So these are the various, including even valet, which is there at the entrance of the hospital. These are the teams which need to coordinate together to deliver care. And BestDoc has been able to stitch together the entire experience journey from the time when someone walks into the hospital. They're able to use BestDoc solutions to let the hospital team know that they have reached. So we have a contactless check-in which has been enabled, where within the geo-fencing of the hospital's location, 500-meter, they're able to tell the hospital team that I've arrived at the location. So even while sitting in the car, the patient is able to let the hospital team know that I've reached, so that they can ask for a patient transport, which is required. For example, it could be a wheelchair to go inside the hospital. And then once they are inside, we are able to continuously track them in terms of their progress of care, meeting a doctor for a consultation, after that going to the pharmacy, then going for an investigation. Or when it comes to a hospital admission with the various activities which need to be done when they are inside the room, we're able to help all the hospital teams know the various requests which are coming in from the patients. And none of these requests are dropped. We are able to track them in a concierge application, which is both mobile responsive as well as app enabled, so that it's easier for the administrators and the managers to know that there is a patient who is requesting for something from this particular room, and my team is now administering that. And if there is a delay in that, then there is an escalation alert. All these have been built in so that the managers and the administrators need not worry about whether care is being delivered properly. And at the end of the day, we are able to provide them analytics dashboards which help them understand which are the most requested activities from the patient side, and then how has been the turnaround time for each of these activities, who has been doing this job well, which should also help the hospital administration identify learning and development opportunities for their own internal team. So as a result, we are continuously improving the operational excellence of the hospital team, and that is being uh, delivered to the patients, which we are able to see in the patient ratings going up. The hospitals are loving the BestDoc products for the simplicity of use and it being omnichannel and multilingual.
Sounds really great. And just coming back to analytics, and you also mentioned earlier that there's several touch points in the patient journey when they from coming into the hospital to being discharged. So how does it really help in capturing all the data that's needed? And you said it really just help improve things for the hospital. So could you comment a little bit more on that as well?
What we have seen is any digital technology would help the businesses, in this particular case, the healthcare providers, collect a lot of information in terms of the various activities and the touch points. So BestDoc has been operating for the last 6 years, and we have till now handled about 9 million patient interactions, which could be either appointments or hospital admissions. As a part of this, what we have also learned is that there are various activities which happen during the patient journey. For example, if you look at appointments, the various channels which the patients use to take the appointments tell us how comfortable they are using a particular technology. If a patient is calling the hospital call center to take an appointment versus the hospital's website or an app, we clearly know that there is a need for us to invest in more solutions which would help the people who are voice oriented. So what we do is, if there is an alert which needs to be sent to the patient, we use a voice based alert. It could be an IVR rather than a WhatsApp or an SMS notification, because we know that these patients would engage in these channels more. If someone has been a tech savvy user, for example, they have been regularly using WhatsApp, we use that channel to communicate further updates to them. And this is being used internally also to know that the hospital communication has improved because of the adaptation to the various technology channels which are available. So we rely on the data which is available, one, to improve the customized patient experience touch points, and two, to help the hospitals understand where they need to invest in the technology as well as the staffing. For example, if the hospital call center is getting a lot of appointments through the call center, we tell them that you need to invest more in the hospital's call center and also improve their engagement. When it comes to the data which is available, what we have seen is most of the hospitals are now looking at that data to identify what kind of demographics, nationalities, as well as what kind of language preferences we need to set. So this, for example, if a hospital is seeing a lot of patients who are coming from Arab ethnicity, or say people who are speaking German, then we identify that these are the languages which need to be put in place to engage with the patients, and you will get better response from them rather than just using English. So this kind of analytics is helping the hospitals improve their patient responsiveness and experience.
Terrific. It sounds truly transformative. And would you like to add anything else to the conversation? There have been such incredible insights that I've garnered from this conversation.
Yes. So, coming from my previous experience of being a retailer as an e-commerce entrepreneur, I thought that healthcare would be also the same, where it's very easy for the customers as well as the providers to adopt technology. But when it came to healthcare, we realized that there is a lot of hand-holding which is required, because solution alone or the product alone will not make the transformation. We believe that the three cogs, which are very important, one is the people, the second one is the product, and third one is the process. All three need to work in together. And more importantly, the people, the hospital staff, the clinicians, the nurses, as well as the patients need to be able to use the technology easily. So that is where we've invested a lot in the process and in the education of the people who are involved in the care journey. And we believe that a combination of people, process, and product put together has helped us improve the way so we don't need to have cutting edge technology. A simple technology being explained to the people and put in a process which is very easy for them to use is where we have been able to transform the way we have worked with our providers. We are looking forward to expanding to 1,000 providers from the 200 plus in the next couple of years. And our recent win at GHE, the Global Health Exhibition at Riyadh, where we were the winner for the Innovate Startup Talks, has given us that confidence that we should be able to expand in the Middle East region in the next couple of years.
Well, thank you so much, Mr. Afsal. Again, this was such an insightful interview, and I'm sure BestDoc is going to be going from strength to strength.